Hi guys, welcome back to my channel. This is Inday RN, your nurse in charge. And on this video, we are going to talk about the processes of COPAR phases. We mentioned in the last video that COPAR stands for Community Organizing Participatory Action Research, and there are emphases on these COPAR phases. First one, as we mentioned in the last video, is that should work in order to solve their own problems, and the direction is internal rather than external. Development of the capacity to establish a project is more important than the project, and there is a consciousness raising with regard to the solution of healthcare delivery within the total structure of the society. As we mentioned from the last video, the nurse in COPAR process or in COPAR technique is that they are the facilitator, but the work should be coming from the people involved or the people from the community. And in order for the community to become self-reliant from the problems that they should have the basic interest in helping each other towards their goal. And the evaluation, actions, setting of goals must be coming from the people. And here in the COPAR, we are also going to discuss the COPAR phases of processes. And actually, we have 6 steps here or 6 phases here, and we have the mnemonics PEDOCS, PEDOCS. In each phase, we are going to discuss the steps being done. Are you excited? Before we're going to start, please don't forget to click like, comment, and subscribe on my channel, and might as well clicking that bell button so that you're going to be updated on whatever upload that I'm going to take. First, let's have the intro. As we discussed from the last video, the COPAR is a continuous and sustained process of educating the people to let them understand and develop their critical awareness of their existing condition. That means people needs to utilize their human and material resources that they have in the community in order for them to become a self-reliant community. And the nurse is going to help them in order for them to achieve the self-reliant community. So, the nurse here in the COPAR process is the facilitator. Okay, so let's discuss the 6 phases of COPAR. The first one is pre-entry phase. Here in the pre-entry, it is actually the initial phase of organizing process where the organizer looks for communities to serve or to help. And also, this phase is considered as the simplest phase in terms of actual outputs, activities, and strategies, as well as the time spent. Because in this phase, we are going to have the activities, and there is the mnemonics C-SID. C for community consultations or dialogues related to the site selection, I for issue checking, S for site selection, I for investigation. So in here, we're doing the preliminary social investigation or the PSI. And the last one is departmental networking or connecting to LGU, NGO, and others. So to further help you in pre-entry, we have the mnemonics C-SID. C like you are going to check the status of the community if they are actually good for the criteria or they pass the criteria, and we are going to check for site selection. Just remember the word C using for the eyes and SID going deeply. But in here, we are just doing C-SID. You are not yet with the community. You did not start yet, so you are still checking if the community passed the criteria of selection. What do we mean by community consultations? In here, we are actually doing some talks related to the site selection. In your organization, you should have this established criteria already, and you already discussed this criteria with your team. So, in here, in the community consultations, you are actually designing a plan for the community development, which includes all the activities and strategies for the care development. And this plan must be approved by your organization. The next one is I, issue checking. In here, setting of issues or considerations related to the site selection is being considered or being checked, okay? Like the socioeconomic status of the community. We mentioned from the last video that the community must be DEO, D-E-O, depressed, exploited, and oppressed sectors from the community, okay? So, they are the depressed and undeserved community with majority of the population belonging to the poor sector. Okay, that is the one you are checking here, the issue checking. The next one here in the issue checking is that we are also going to check for their health services if it is inaccessible. Is this community having a problem about mobile, like transportation going to the health centers or the nearest hospital, something like that. Okay, next one here in the issue checking is that, is the community poor in health status? Okay, you need to check those also. And is the area having peace and order? Of course, you also need to check for your safety as the facilitator. And the community that you need to choose should have a good peace and order. Okay, and the last one here in the issue checking is that the interest of the community. Are the people from the community accepting the program? If they are not accepting the program, then that's a big issue. As we mentioned from the last video, the community should have the basic interest. Okay, got it? Now, let's move to the site selection. Here in the site selection, we are going to consider some things here. It is not because the community is qualified for DO or the depressed, exploited, and oppressed community, they are already okay. We have some criteria here in site selection, like the initial networking with the local government. Are the local government officials actually considering this COPAR to be introduced to them? Is this community having peace and order? Are the community safe? And if you're going to enter the community, are you going to be safe also? Those are some of the site selection criteria that you guys need to check in that community. Of course, here in the site selection, you are going to do some ocular survey prior to the entry of your COPAR in that community. Okay? The next one is investigation. Here in the investigation, it is only preliminary. Okay? Preliminary social investigation, meaning to say you are not yet doing some deep investigation here. It's just preliminary. It's like in the epidermal layer of your skin only. Okay? So, you need to consider the using of data here. The secondary use of data from various governmental officials, particularly maybe in the provincial health office or from the RHU. You can also use the secondary data from other community-based health programs. You need to check if there is already an organization with extension workers from both government organizations and NGOs. Because if there is already the coordination of the community from other NGOs, then a conflict of interest might happen if you are going to jump in that community without checking it. Moreover, here in the preliminary social investigation or PSI, you need to conduct ocular observations noting the accessibility, geography, terrain, settlement patterns, and available physical resources. As I've mentioned earlier, you also need to check if the community is having a good access for health services. Because if not, then COPAR can be introduced in that community because they really need help. Do not forget that here in the pre-entry phase, you are only checking the overview of the community. You are not yet going deeply in your investigation because you are not yet still with the community. Okay? And the last one here in pre-entry phase is departmental networking, wherein you need to have a link to the local government units or LGUs, NGOs, and other departments. That can help you soon in the phases of COPAR. Okay? Remember, here in the pre-entry phase, it is done before going to the community. And remember the mnemonics C, SID. Always remember your eyes. Okay? The next one is the entry phase, wherein we have activities also here. And as I've mentioned earlier, in the pre-entry phase, we are not yet going deeply with the community. But in here, in the entry phase, we are already digging. I stands for you as a nurse and dig. Okay? Remember the mnemonics? I dig. I dig some information. I'm checking some information. So remember the word I dig. Okay? And here in I dig, I stands for integration with community residents. D stands for deepening social investigation. I stands for information dissemination. And G stands for group or core formation. Okay? So here in I, integration with the community residents, you are already doing some ocular survey, meaning to say you entered already in the community and you have the checklist to check the structure of the community. Remember, here in the pre-entry, we mentioned earlier to have an ocular survey, but we are not yet with the community. Okay, remember that. It's here, preliminary social investigation. We did some ocular survey here, but we did not go to the community yet. Okay? Unlike here in the E or entry phase, we are already doing or using some checklists to have an integration with the community residents. Okay? Doing some courtesy call with the community residents. Maybe you can do some formal courtesy to the barangay officials or to the community officials, I should say, and giving them the purpose why you are there in the community. Okay? Here in the deepening social investigation or letter D, as I've mentioned earlier, you should have the checklist. The checklist that you want to gather some data. We did actually the social investigation in the pre-entry, but it is just only the PSI. Here in the entry phase, you are deepening it. You are digging some information. You can do some mapping already. You can check also the drainage of the community. Also, you can check their knowledge about their health condition, or maybe some vaccinations. Do they have a knowledge on that one? You are actually checking deeply here. From the word deepening social investigation, you are getting some information that the community needs to work on, where you can help them in the future in solving their own issue. Here in I, as I've mentioned earlier, you can tell them your purpose. So, information dissemination. You can tell them your purpose, why you are there in the community, why you are doing social investigation, and what is the importance of the thing that you are doing. Okay? So, remember, information dissemination. And the last one here in the entry phase is the core group formation. In here, we are also developing the criteria of the selection of the core group members. Example of this are members should be respected member of the community. They should belong from the poor sector of the society, must be responsible, committed, and willing to work for social change and social transformation, willing to learn, and must be able to communicate and can express oneself in the group. So in here in the core group formation, we are not just getting people here. We are encouraging people with interest. Remember the word interest, willing to learn, and responsible person from that community. Because soon, they will be the people that you are going to train. Okay? Remember that. And always remember that they should belong from the poor sector of the community. Because if they came from the poor sector of the community, of course, they will be interested in working in their own issue and willing to work for social change. So here in the core group formation, I repeat, we are establishing the criteria for members. That is the one that I mentioned earlier. Respected member of the community, belongs to the poor sector, must be responsible and committed for change, willing to learn and able to communicate. Also here in the core group formation, once we already have the criteria, the roles and functions are also established. These roles can be delivery of basic health services, coordination, and there is a good consultation with other community organizations, and of course, a self-awareness and leadership training must be done also. Okay? So remember, here in the core group, we have two steps here. We need to check for the criteria, and we have established roles, function, and task of the core group. Okay? They are just connected. Okay, remember here in the entry, you are deepening your investigation. So remember the word I as a nurse will dig information. Okay? So I, integration with community residents. D, deepening social investigation. I, information dissemination. And G, group or core group formation. The third phase of the COPAR is diagnostic phase. In here, we are actually doing community study, or it is the research phase. Okay? So if we say research, one of the methodologies in nursing in order to improve some initiatives is the FPDCA. Okay? Let's use that, but it is a different meaning. In order for you to easily understand it, I use the mnemonics FPDC. It's like focus PDCA. So F stands for focused on team selection. P stands for preparation. D stands for data gathering. C stands for community validation. And A for assessment and prioritization. Here in the focus on team selection, we are actually selecting or establishing the research team. And I told you earlier, all the members and teams should come from the community. Okay? So here, you are doing the selection of the research team. So F, only focus. So F, first, focus. Focus on the team selection. By the way, why are we doing this diagnostic phase? Because here in the diagnostic phase, we are actually doing the identification of problems. I told you before, right, from the last video, the community will going to work, do actions, set goals, evaluate, everything they will do. But the problem is, the root of this one, the community should know their problems in order for them to set immediate and long-term goal. Okay, so here in B, the people are doing diagnostic phase, and here in the diagnostic phase, meaning to say, people are doing checking of their problems. It should be identified by the people from that community, and that problem is an issue affecting the whole community. So, let's go back to FPDCA. F stands for focused on team selection. The next one is preparation. Here in the preparation, you are actually doing training. Training for the methods and techniques, and you are also doing planning for actual data gathering. So here in the preparation, you are training the people. Let's say the team already. You are training the team on how are they going to see if there is a problem. You can use some techniques here. You can apply some methods. You can apply methods and techniques in the problem identification. There could be cause and effect. That can be one. And of course, you can do some fishbone analysis if you are so knowledgeable in doing the fishbone diagram. SWOT analysis if you are able to do it, or if you have some knowledge about it. But the easiest is using the cause and effect method. Okay? After doing the training for the methods and techniques is that you are also going to prepare an actual data gathering. You can do some templates here in your data collection. You can use the online through Excel, or you can use manual, no problem. So remember here in the preparation, you need to train the people who are there in the research team. Train them on how to use the methods and techniques in identification of a problem, and train them also in planning the actual data gathering. Okay? Do not forget it. Letter D is the actual data gathering. Here in actual data gathering is that you are going to do some surveys. You can do some qualitative methods like interviewing the people, or you can do some quantitative methods by only checking the objective things in the community that you can use. For example, how many pregnant women are there in the community, and how many children are compliant with their vaccination, something like that. Those can be the data that you can gather from the community. And in terms of qualitative one, an example of this one is, are the people satisfied in the resources that they have in the community, especially about health? You can do your gathering of data in a qualitative way or in a quantitative way. Okay? The next one is community validation. After data gathering, you are going to collect all those data that you have and do some tallying. The last one is assess and prioritization. From your data gathering to community validation, you already have your tabulated data here. And once you have this tabulated data, you can do the ranking and assessment. First, do the ranking, or we are saying it prioritization. You can arrange the tabulated problems that you have on hand in a ranking way, and you can assess if this is one of your priorities or not. So always remember, do data gathering, then community validation, then do your assessment and prioritization of problems. So here in the diagnostic phase, actually, we are checking the problems that people have in the community. But as I've mentioned earlier, it is not you who are going to do it. It should be the community. And in here, in the diagnostic phase, you need to train people or focus on team selection who will be trained for this diagnostic phase or the community study. Once you have already the team, you need to prepare them in the methods or techniques that they are going to use, and you guys need to work hand in hand in planning for actual data gathering. Once that is done, you are now ready to do the data collection with the community and do some community validation. And of course, the last one in this phase is the assessment and prioritization of problems. Okay? Remember FPDCA. To add also, here in the assessment and prioritization, in prioritization, you need to base your assessment through community needs, problems for action, and recommendation. Okay? So, there should be a presentation of community diagnosis and recommendation. So the next one here in the COPAR process is the organization and capacity building phase of the community. In here, we have actually activities, and the mnemonics is meeting. Remember every mnemonics that I'm presenting here because they might help you. In P, I've mentioned CSID. E, IDIG, D, FPDCA, and here in O, meeting. So remember the word meeting, meaning to say we are doing a lot of meetings here. We are doing some capacity building here, meaning to say we are building the community through some organizational meetings. Okay? So here, in community organizing and capacity building phase, M stands for meeting of the community. So since we already have a core group and we also have prepared already research team and we have identified already the problems of the community, we are now ready to discuss these things to the community, to those residents that are there in the community. Okay? So we can do meeting of the community. We can gather them. The next one is E, establishment of officers. Since we are doing the meeting, in that meeting, we can now establish the people who are going to be trained more in our process. Okay? So here in the establishment of officer, we are doing election of the officers. And once we have election, since these people do not know each other yet, though they are in the same community, of course, they don't know each other. Okay? They might bond, they might talk to each other, they might be in that community for how long already, but we don't know how they are socially involved, especially in some activities for changes. So, we are going to do some team building. Okay? Remember the word team building or ARAS or the ARAS. The next one that we are going to do is induction. You can do the induction while you are doing the team building. But I prefer you need to do the induction first before the team building. Okay? So once elected, you can do the induction, then next is team building. But others are actually doing both or at the same time. There's no problem about that one. But in the real process is, or in the ideal process, you need to do the induction first before doing the team building. That is better. And that is right, actually. The next one is N. I cheated a little here. So N stands for functionalities of the organizations. What do we mean here in the functionalities of organizations? Here, we should have a working committees. There should be a working committees that stand for our COPAR. Okay? They should not be elected to sit. They should be elected to act for the community. They should be the one to lead the community. And as I've mentioned earlier, we cannot do it without the interest of the community. So, in order for us to have a working committee, we should have these committees to be functioned according to what are they planned for. Okay? So, we should have a working or functioning committees. So, next one is the group leaders training or the training of the CHO officers or community leaders. So in here, in order for us to have a functional committees, we need to train them. As I've mentioned earlier, nurses are the facilitators here in the COPAR process. So you need to train these people because they don't know yet on how to act on their issues. Okay? You need to facilitate them. You need to teach them on how to do this, do that, like that, in order for them to apply it. Always remember, you cannot apply what you didn't learn. Okay? So here, you need to train these people based from the development plan that you did or that you established in the pre-entry phase. Okay? Remember those things that you did here because you can now apply it in the organization phase. Okay? Don't forget it. Remember here in the organization and capacity building phase, these things, meeting, MEETING, is that these activities here entail the formation of formal structures and inclusion of more formal procedures like planning and implementation, as well as evaluation. And in this phase, the organized leaders or groups are being given trainings. It could be formal, informal, on-the-job training like that, in order for them to develop their skills in managing their concern in the community, in managing the people in the community. Okay? So remember the word meeting because that is in the organizational phase. The next one in the COPAR process is C. That is the community action phase. So remember, in O, here in the O, we focused only in the CHO, okay? Or in the community group leaders, okay? So in each phase, we are actually focusing. Let's just review it quickly. P, you are preparing for yourself. E, you are introducing the COPAR. D, you are doing some research or problem identification. O, you are training the group leaders. And here in C, you have mnemonics, work, okay? Work, meaning to say community action. You are already doing some work here, okay? Remember that. In this phase, our focus are not the leaders, but the workers already, okay? The word work, your focus, workers. The word work, you are doing some actions, okay? Now, here in W, that means workers establishment. You are doing some organizational training to the community health workers. Okay? So they could be the BHW or the barangay health workers. You are already doing training to them. Oh, by the way, prior to the training, you need to select first who are your workers in that community. Okay? And always remember, do not select if they are not interested. The word interested here and their willingness is essential, okay? So in here, prior to the selection and training, you need to develop the criteria of selection for these healthcare workers. They should have the willingness and interest to join the team, okay? Let's be clear, here in the workers establishment, you need to develop the criteria of selection of healthcare workers. Once the criteria is established, you can now select the people who can join the workers team. And of course, once you're done with it, you can now train them. And once you already establish the workers, you can do organizational setup also through setting up linkages or networks or referral system. Okay? But it is not you. Let me just clear. It is not you who are going to do it. You're just going to facilitate the community leaders here. Okay? They should be the one to do the connection or to do the linkages. Okay? Clear? And the next one is R. That is resource mobilization SIM. In here, the community needs to identify the resources that they have in the community in order for them to use it in solving their problem, in solving their issues. It could be human resources, material resources, community resources. So here, they should have an initial identification of their resources, and of course, they need to use these resources in fixing their issues. So once there is already establishment of workers, there is already an organizational setup, and the people already identified the resources that they have in the community, the workflow, of course, will be okay. So remember, here in the workers establishment, the development of criteria must be done or must be established. Then a selection of community health workers will be done. And the last one here in this step is the training of the community health workers. Here on organizational setup, the community should have linkages or good connection and referral system. And of course here, do not forget the PIME, the project implementation, monitoring, and evaluation of health services, intervention SIMs, and community developmental projects. Remember that here in community action phase, the work here is being done. There are a lot of things to be considered here. Always remember that the people needs to identify their problem and act for their problem. So, there should be a project implementation. So, once you already have identified the problem and you set up your goal, you need to implement, of course, an initiative to solve it, okay? So, once you implemented a solution already, you need also to monitor. Is this correctly being done by the community members? you need to monitor it. Is there any sustainability in the actions? You need to set for a time. It's up to you already because we don't know if it's an immediate or long term, right? So you need to let the community health workers or the community leaders, of course, to monitor if the action or the solution is being implemented well in the community. So do some monitoring of your actions. And the last one is the people needs to evaluate if there is a good implementation of actions. Okay? So once the work is already running good, running smoothly, of course we can say that this is okay. And that is your K in the community action phase. The last one here in the COPAR phases is the S. That is sustenance and strengthening phase. And in here, we can say that the activities that we've done is already finished. That is the mnemonics, finish. So meaning to say, once you already reach the S, we are already strengthening the community. The community is ready for turnover. They can now get it without the nurse. Always remember that the action of the nurse here in the COPAR is not forever, because you are building the community to be self-reliant. Meaning to say, you will teach them. You are going to help them identify their problem. The help will end, of course, because the community are already strong enough to solve their issue. Okay? So, remember the word finish. And in here, the formulation and ratification of constitution and bylaws. Meaning to say, we have already formulated constitution to guide the community. I is identification and development of secondary leaders. Earlier, if you can remember, we trained the core group, okay, the leaders of the community. But in here, in the sustenance and strengthening phase, we are already developing the secondary leaders. It's not only the primary leaders, but we already have secondary leaders that can help the community leaders soon if the nurse will go out in that community. Because they're already strong enough, right? So, we need to have secondary leaders. The next one is N, that is network or links or referral system formalization, meaning to say that the community established trust already to some of the NGOs or LGUs that are helping them. So, they already set up a good network. The next one is I, that is implementation development of viable committees, management system, plans, and medium and long-term goals. In here, the development and implementation of viable committees, meaning to say, we mentioned earlier that there should be a working community, right? In that working community, we need to monitor it in order for it to be viable, in order for it to be visible. They should be able to be seen like an independent unit or independent committees. Okay? That is working or functioning. The next one is S, that is setting up and institutionalizing financing scheme for community health activities and programs. And the last one is H, that is health workers of the community's continuous education. The facilitator or the nurse should also do some health education to the community leaders, to the community health workers, CHO members, and community residents. This continuing health education is only the strengthening phase, okay? Because we did some training already to the community leaders and to the workers. And in here, it will be the strengthening. You are going only to feed them a little because you already established the community leaders and community health workers here. So in here, you are just doing some guidance or maybe an additional or an update to their knowledge. Okay? So remember here in the sustenance and strengthening phase, it's already a phase where the community is ready, the committees are viable, their networks are already formalized, and there is already an identification or election of secondary leaders. Always remember that the sustenance and strengthening phase occurs when the community organization has already been established and the community members are already actively participating in the community-wide undertakings. Okay? Meaning to say that the community are doing more. The initiative is coming from them already. What I'm saying here is that they can now stand on their own. And at this point, the different committees set up in the organization are already expected to be functioning by way of planning, implementing, and evaluating their own programs with the overall guidance from the community-wide organization. Okay? So through the help of the community leaders, the committees can now give help to the community residents. They are now visible enough, and they can now give a reasonable chance of succeeding some actions. Okay? So that is PDOCS. P stands for Preentry, E stands for Entry, D stands for Diagnostic Phase, O stands for Organizational and Capacity Building Phase, C stands for Community Action Phase, and S stands for Sustenance and Strengthening Phase. There are strategies that you can use here. You can use the education and training, networking and linkaging, conducting of mobilization on health and development concerns, implementing of livelihood projects, and developing secondary leaders. Remember those strategies that you can use, okay? And they can be seen in different phases of COPAR. So I guess that's all for this video. Thank you guys for watching. I hope you guys understand the processes of COPAR phases. And if you do so, please don't forget to click like, comment, and subscribe on this channel. Might as well hit that notification bell. Don't forget to check the other videos that I have on this channel. Maybe they can help you. I already have a playlist for community health nursing, so maybe you can check that out. If you guys need some help again in nursing topics, or if you have some difficulties in nursing, you can comment your problem down below and maybe I can help you. So thank you so much guys for watching. Don't forget to give me a thumbs up and share this video to your friends. See you on my next video. Bye!